First of all, I would like to thank Dr. Murthy for inviting me today and for recognizing my work. I wanted to say that today when we're discussing, we don't know too much about you, Dr. Murthy, but after coming here, we've learned a lot more about you, which is very nice. I'm not a medical doctor. That's the first thing I told Dr. Murthy when he called me, that I'm not a medical doctor. I'm an activist. I work in the field and I work with women's rights. And as he pointed out, whether it is female infanticide, sale of girl babies, whether it's violence against women, whether it's neglect of women, and in more recent times, we are seeing that there are lots of cases of molestation of young girls by their own family members. Leave alone talking about others or neighbors or someone they don't know. A lot of social issues that are coming up in our society which need to be dealt with. Sir, Dr. Murthy Garu, you did say that we need wealth. I'm not one of those people who believes that we need to be wealthy, but we need to be self-sufficient for sure. So I'm 100% in agreement with you on that. I ran away from home when I was 24 years old. So I was a very bad woman because I also had a small son, and it took me a year to decide whether I should do it or not, etc. And when I went to Delhi and I started living there and working there, I realized that the problem I had faced was very small, and that people are really facing lot of problems, and women particularly are facing lot of problems. Dowry deaths, pregnant women being killed by their husbands, and when they come home, when the girls come home, they are being told कि तुम्हारी जगह अपने husband के घर में है, मायके में नहीं है. So they were being sent back, and then the girls were either killing themselves or being killed. So as a response to that, I and a group of friends, we worked together and we set up a women's organization called Saheli Resource Center for Women. And that center became a place where any woman who wanted to survive with dignity, because if a woman is pushed out of her natal home and her husband's home, where is she to alive? Today we see many of us are working, educated, able to do that. Otherwise, a woman is just on the street. A lower middle class woman, a working woman is better off because she can go and do some job. But to look after 3-4 children is not easy when you're a single woman. It's quite tough. So I have worked since 1975-76 during the emergency. After the emergency, friends who had been in jail came out. We helped to organize unions. Sir, I have worked with a lot of men. Even now, I work with a lot of men. I do development work, land development work. I was one of the first people who introduced watershed development and land management in Telangana, then Andhra Pradesh. So without going too much into the work that I have done, I just want to say that many of us are working need-based. When the community needs something, we are standing up for them and we are helping them to think through what is good for me, as well as working with government very closely to set better policies. So my interactions, I have some doctor friends in my doctor friends as well as in the family, but my close interaction with the medical fraternity and working was during COVID time. We are a group, an NGO, women's organization working in the field in Nalgonda district in Devarkonda area, but in the second wave we got lot of cases. In the first wave we didn't have any cases in the villages, hardly 1 or 2. And we, through a small organization, we had doctor friends in Hyderabad who did online consultation. And so I agree 100% with you, because the doctor Rehana would spend 1 hour talking to each patient to make them feel better. And I can tell you that we dealt with 685 patients and we didn't lose a single person. And we were able to get the kind of medical care they needed, and many people came forward to help, because we are not an international organization. We work with very little money, but seeing our work, more and more people came forward and supported us. Other groups supported us, as well as we provided the provisioning of food to migrant workers. Almost 5,000 people in our own project area and in Hyderabad as well. So I just want to conclude by saying thank you very much for this occasion. Thank you all.